Okay, everybody. I see some nice discussions. I'm sure you're asking each other what brings yourselves joy. That's what you're doing. So let's open this up for comments, questions from the group. And I know that you may have had a chance to say, hey, this is kind of what we'd like to have considered from our table. And I'm going to look to this side first. Yes, Hadi, please.
We're going to jump right in, and I thank my table mates for endorsing the question we're going to ask Dory primarily. So you've really demonstrated in a very vivid way how to change culture through your compassionate care initiative. And what we want to do is do a little bit of a deeper dive to kind of see what was the lever or levers that allowed that culture to shift. And I'm going to give you three things and maybe you could select out of it. So the first thing is the dean goes to a retreat and gets enlightened. And so you come back as an enlightened leader and you decide you're going to do something, and then you marshal resources to invest. And you find opinion makers that you're willing to jump in. But then the question is, what was the key there? Was it you walking the walk? Was it getting the opinion leaders? Was it the transformative experience? Where's the faculty now with this? As one set. And then there's another important subset to that, which is the contemplative practice seems to be a big part of what you're doing. And the question is this really about community building and bringing people together, or is there something unique about the contemplative practice that brings out self-awareness and other aspects? Now, obviously, I have my biases, but we want to hear from you on how you view this.
Well, it's a great question. Is this what? Yes. I do think that when I came in as a brand new dean, I decided that the best way to get to know people was to be. Oh. Okay, and you don't have to keep, the best way to get to know people, all right, thank you, technology. The best way to really get to know people was to be as visible as possible. Sit next to new people at meetings, show up, be friendly. You go to these meetings, everybody's like this. Everybody is got their head in their crotch because they're doing their iPhone, and I would be there chatting away. What are you doing? This is what we're doing, and we're a small school, but I got known pretty quickly, even that 2008 year. And then when we had an opportunity to go to UPI, I really said, my faculty are going to kill me. I shouldn't be leaving for an 8-day silent retreat. But it was the best thing I did. And the other 10 people that went the first time, we are all still very bonded. And so it's the ability to keep that generosity going. When funding stops, people go, oh, that's the end of it. Well, I just decided it was such a good thing. The next year I had 15 people who wanted to go. I've had doctors go on their own, saying, well, I could maybe do your plane fare. Now we have a list of people. So it's being generous and not worrying about the money. I am one of 11 deans. All we ever talk about is we don't have enough, we don't have enough, we don't have this, we don't have that. And I'm so sick of it. It's like, okay, what do we want to do? And then we'll find it. And the donors and people that are funding me now, they love it. And people are only going to give to success. And so I do think a lot of it is making friends, colleagues, and having a generous spirit. And so when I didn't have an endowed chair, I spent $75,000 every year for 4 years on workshops, bringing Monica Sharma, who ran leadership and capacity development at the UN. She came and did 7 workshops for us. Very expensive, but it was fabulous. I invited everybody. She said, well, I want to see the stakeholders. So I invited the head of the cancer center. I invited one of the other deans. I invited the policy people. They were like, well, what's this all about? But everybody got excited. Now, everybody didn't stay engaged, but it was huge to the point where I was invited 3 years ago to give convocation address to every new student at the University of Virginia. And I talked about compassionate care and what we're all doing together. So I'm not saying, well, that course is $7,000 and who's paying for it? And, we just get down in the weeds. And I think if you stay up, That's the strategy. I don't know if there was another piece, but that was, yeah. Was there another piece? Yeah.
So we had another piece, and that's really looking at the relationship between doing solo meditative work
Oh, yeah.
and
Yeah.
doing community.
Right, right.
Building community,
Yeah.
and how those interact
Sure.
in your program.
Well, I think the community work is, you just stay at it. The first course that I put the resilience retreats in, it was in a med-surg course. I said it was clinical time, and the faculty, they just didn't like it, and they acted out. So I just said, okay, fine, moved it right into the psychiatric nursing course, and it worked fine. So I think you build community by not having a barrier. And then if people are not on board, you just keep moving forward. There are so many allies out there. There are so many allies now. And so I have just kind of respected people and then just built. So our 6 a.m. meditation group, I wouldn't have picked 6 a.m., but our little Sangha now has gone on for 8.5 years. It's docs, it's NICU physicians, it's ER people. We have a greeter, somebody who stands in front of the hospital. He's coming to our meditation. So I think it's just, and everybody's welcoming. So I think, that's how you build community. Thank you for those questions.
Question?
So one of the things we were interested in is overcoming barriers to change, and I appreciate that the topic here is culture change. So one of those barriers is the amount of pride that people in our professions take about working really hard and knowing a lot and applying their skills diligently in doing that. And that's why we get this culture of, I worked 100 hours a week. I worked 120 hours a week. I worked 122 hours a week. And that's where we put value, or we seem to put a lot of value. And we know, from a well-being perspective, we need to kind of ratchet that back, and we need to have time for self-care, reflection, and the things that we talked about. So the question is, how do we continue to not strip people of that value that they hold in those things, but still get beyond that to good self-care?
That's a really, really interesting question. I think in the veterinary profession in the UK, there's come a crunch point which is slightly outside of that remit, but which is enabling us to look at it really in focus, which is a recruitment crisis. So we've got a real issue with veterinary professionals coming out of the profession after about 5 to 7 years because they're finding that it's just not a profession they want to be in. The level of work is just too difficult. So you're getting the, shall we say, slightly older generation saying, yeah, this kind of one-upmanship, I work 120 hours, I work 130 hours. Firstly, my challenge back to them is, well, how did that work out for you? Those suicide levels are not great. But you didn't talk about it. They complain that this new snowflake generation, as they like to call them, talk too much about it. Well, my view would be that as a population, we have all raised that generation. I'm not even a parent, I don't have kids, but we all take responsibility for raising that generation. And actually the points they're making about not wanting to work themselves into the ground are very, very valid. So if the crunch point where that senior generation and the younger generation come together is, I want to stay in my profession that I love and I want to hire people and have the ability to hire people, then that becomes the point at which people are more willing to talk about making adjustments, which makes it better for people to stay in the profession. And I think it's a really valid point about that role modelling, and it's something that we're trying breaking down with Anne-Me, is that certainly in the veterinary profession, and I'm sure it's perhaps the case in human medicine as well, the people who teach the veterinary students, the undergraduates, are specialists in their field. They tend to be more and more specialist in the area of work, but don't tend to talk about the day-to-day stuff that doesn't go well in general practice. So if I asked a crowded room of people, and I've done this before, to put up their hand if an academic or a veterinary lecturer was a key influence on them and continues to be a key influence, somebody that they think about all the time as somebody who's a real role model for them, nearly every hand in the room goes up. I then ask them to put their hands up if they ever remember one of those lecturers telling them about something that went wrong for them in their career. Tumbleweed. Nobody. So there's obviously a disconnect there. So we need to get the humanity and the reality back into undergraduate education so that when people start to face that messy reality of life, they don't think that it's them that's at fault. They recognise that this is something that's happening. And that's the point, I think, at which we try to encourage people not to take this kind of macho approach to work-life balance and trying to recognise that actually to be good professionals and to keep these expensively trained individuals in the profession, then we need to be more honest about that.
And this is for Dory. Brenda Zeeler, University of Washington, representing the American Academy of Nursing. I don't have a question, but I have a testimonial to Dory's modeling of the behavior she's talking about. I had the privilege to visit the University of Virginia, and although she says her faculty, it may not have been happy with certain things, where she put things in classes, adore her. And I was invited to her house with her husband, and she talks about what brings her joy on the campus. It's a beautiful campus. But it takes leadership, and I think that's what our table talked about. It takes leadership and the investment that you had in your folks. And so I don't think it's a model that could be just implemented anywhere. I think it takes someone like you, and with your leadership and with your own personal development that turned around and was able to do it at your side. So thank you.
Well, thank you. You know, some of it's genetic. I had a mother who used to say, well, anyone can have fun in the sun when we're out there picnicking in the pouring rain. So I think some of that optimism, is, and you know what, it can be very much, it can become an epidemic of optimism as opposed to we don't have enough. Thank you. That's very kind.
So I'm going to build on that question on leadership. We talked at our tables that sometimes it takes great courage, Dory, to be a leader when there's a lot of opposition. And you started this in the School of Nursing, but it wasn't institution-wide. And I remember when I interviewed you, you actually talked about your role as dean and some specific ways that you interacted with faculty and decisions that you made in terms of hires that you made. And I remember one conversation we had where you were talking about, faculty were not very nice to each other sometimes, and sometimes there were some really negative faculty. And some ways in which you, even in choosing people that would do what, I think role modeled the kind of behavior that you wanted in terms of outcomes. So would you talk a little bit about that courage and opposition and leadership?
Nice. Well, I'm going to get a swelled head. But, when I first got there, I had been president of the American Association of Critical Care Nurses, so I had great leadership training. And our Healthy Work Environment Initiative made me very sensitive to how people talk to each other. In fact, I just wrote a paper on no time to be nice in the ICU. I was talking to Simon about how rude some people can be because of stress. And I think it's important who we hire. That's the most important thing I do, is who I hire, and then who maybe I move along with the help of department chairs. And when I first got there, in 2008, I watched some emails flying around, and I was like horrified. And so within 1 week, I invited myself to 2 department meetings, and everybody's sitting there, the dean's coming. And so I said to them, well, your teaching is great, your research is great, and your communication is at the kindergarten level. Now, I was yelling at the whole class, which you never want to do, but everybody went like this, and things stopped. And I went right to the next department, and I think it was the best thing I did. I mean, I was there for less than 1 week, and I said, I'm watching these snipey emails, and then it's how you role model. You brought that up. It's every email I write. If it's a big issue, I'll say, this sounds important, let's talk. That's it. And gradually people started, modeling that. Plus, that's the joy in work thing we did. No emails on weekends and no emails after 5 p.m. Now, I know for busy healthcare, but I am telling you 88% satisfaction. And I said, well, this is the stupidest thing I ever heard. But you know what? The faculty and staff loved it. And it has totally changed. So there are some things as a leader that you get behind and you can do. I think deans and, chief nurses, chief whoever, whatever role you have, you need to be doing the things that only you can do. And it's very unique to start thinking about that purpose every day, you know? So we need to be doing that. And then it gets to be fun.
Wow. Thank you. With that, we have wrapped up our time here. I just want to have everybody thank our guests, our speakers, Dory and Lizzie. That gives us hope for what we can accomplish in the health professions.